what advice would you give to the person that maybe possibly scared to take the next step when it comes to talking about a treatment plan and tell you some of the things that they're facing?
I think the first step is just booking a consult. I mean, you don't have to commit to anything, but, you book a consult, you can kind of talk about anything that's bothering you. With aesthetics, people usually come in and they, have one specific thing that they're kind of focused on. But during the consult, we can kind of make other recommendations.
Look, the biggest podcast where you can learn them lessons. Line for line where you can learn from different sections. Made it out the mud, come tell your story, blessings. Never know who listening, never know who stressing. Divine gave you a voice, come speak your honest truth. Line for line, go bar for bar, it's up to you. Wanna talk sports, gov, and politics? Wanna talk about where you from and your accomplishments? Then Line for Line is really where you need to be. A platform that's really made for folks like you and me. You can find it all no matter what you seek. Whether you calling or you listening, tune in every week.
All right. Welcome back to another very special episode of Line for Line Podcast. I'm your host with the most, Devon Booker. We have a very special guest in the building today. We have Mrs. Abby Zimmerman in the building. Abby, how are you feeling today?
Good. Happy to be here.
Yes, ma'am. We appreciate you having some time for us on this Sunday. When we start Line for Line Podcast, we do the most cliche thing ever. We have the guests just tell the world just a little bit about them, their profession, things of that nature. You now have the floor, ma'am.
Well, I am a nurse practitioner. I've been a nurse practitioner for almost 10 years now, about 10 years. I started off working in the hospital, and then I kind of transitioned into like the med spa, health and wellness space now.
And how long have you been doing that for?
Since 2020. So when I first started, I was still at the hospital, and I, worked in my clinic, and then I was kind of just like dabbling in aesthetics on the side. And then I left about 2.5 years ago from the hospital. So I've just been doing this now for the last 2.5 years.
Now, when you talk about starting your own thing and venturing off to do your own thing, can you just tell us a little bit about what helped you pursue that route that you took?
Yeah, I think, I was working in the hospital, COVID kind of hit, and like most healthcare providers, I was just kind of burnt out. And then I also have little kids, so I was trying to find something with like a good work-life balance that I could be home with them and still be doing something that I love as well.
Of course. Now, what would you say first drew you to the whole aesthetics injectable side of the business that you operate?
Well, I've always been interested in plastic surgery, like ever since I was like a teenager. I always watched like the plastic surgery shows, and I was just really like enamored with what people were doing and like these transitions that are like transformations people were having. And then I kind of saw, a lot more once people started talking about it on social media, a lot more of like the injectable side of things. And I was like, oh, I could do that. I'm a nurse practitioner. So I signed up for a class and got started. Of
course. Now you guys do hormone replacement therapy, correct? Can you just tell us a little bit about that and like the benefits that come with that?
Sure. So for HRT, I mean, I'd say the majority of people we're seeing are, for women, it's menopause or perimenopause age. For men, and of all age groups, we kind of see up to like 80 years old. So typically people kind of start to notice they're having symptoms that they can't really explain, and they are kind of just looking for a fix for that. So yeah, typically people are having symptoms of some sort when they come to see us, and we kind of just start with blood work to kind of see where they're at with that. We do see some younger women as well before perimenopause. It just kind of depends on what their symptoms are and what's been going on.
Of course. How would you say that you create a comfortable environment for patients who may feel vulnerable when it comes to hormones or even aging?
I think kind of listening and just letting them kind of lead the conversation to start with. We always start with a consult. So, they're not just coming in off the street. They typically have something that's bringing them in, whether that's like a symptom or a concern that they're having. So kind of just like listening to them to see what they're looking for or what's been bothering with them. We kind of start there. And then just kind of being open and honest with communication.
Of course. Can you just tell us a little bit about the name, the location of the practice that you operate and work at now?
Yeah, so I'm at IVme Milwaukee Wellness and Aesthetics. So we're in the 3rd Ward downtown.
Nice. Now, are there any new innovations, services that you are excited about?
Yeah, so typically, right now we're kind of doing like all aesthetic stuff. We have an esthetician. We do a range of wellness stuff from IVs, vitamin shots, NAD, weight loss.
Oh, wow.
And then hormone replacement. And we're kind of just starting to get into more peptides. So that's kind of exciting to, see kind of where the peptides go, because it's kind of the new thing that everyone's kind of been talking about recently.
Got it. Now, with IV therapy and wellness being extremely popular and on the rise, what role would you say that they play in preventative health?
Well, I think it can play a big role in a lot of people's preventative health. It kind of just depends on your lifestyle and your concerns. We have just regular hydration IVs. We have an athletic IV.
Oh, wow.
We have IVs that help with your immune system. So if, you are someone that works in healthcare or just kind of has like a lower immune system, or just you're trying to prevent illness. For me, I have little kids that are constantly bringing stuff home. So I usually do like a monthly just super immune IV to kind of just help boost those vitamins and kind of help fight anything that my kids bring home.
Got it. How would you say you monitor a patient's progress during the treatment process?
For what specifically? For just
for let's say
hormones?
Yes, ma'am.
Okay, so for hormones, we kind of start with a consult. We have everyone fill out a symptom tracker. So it's kind of an array of symptoms that they could be experiencing, whether that's kind of like, fatigue is a big one that people have, weight gain, sexual symptoms like low libido, difficulty achieving orgasm, erectile dysfunction, joint pain, hot flashes for women, sweating, feeling cold all the time, hair loss. So there's a array of symptoms that we kind of have them rate on a scale of 0 to 4. And then we kind of have like a total, like what their total is. And that kind of classifies them into like mild symptoms, moderate symptoms, severe symptoms. So we kind of have that tracker when we start. We get a lab panel. We do a full consult so we can discuss all the options with the patient. And then we have that when they come back, we have them fill out that symptom tracker again. Of course. Sometimes for hormone replacement, it's not just like a switch that your symptoms all just like switch off after you get treatment. It's kind of a gradual thing. So like every day you might feel a little bit better, or to the point where you're not really like noticing fully what symptoms you're having and when. You just know that you feel better.
Of course.
So when we have them fill out that symptom tracker, we kind of can see, look at your symptoms have improved in all these areas. And then also labs that are kind of showing us, here's where you were, here's where you are now. Of
course. Now, what would you say you enjoy the most about serving the Milwaukee community?
It's just a wide variety of people that we see. We see a lot of just regular people. We also see a lot of athletes. We see, kind of high executive people with powerful careers that are kind of burnt out and like looking to kind of get to the next level or just feel their best. A lot of moms that come, or parents that come in, a lot of students. There's just a wide variety of people that we see.
Of course. Now, with this business being extremely popular and you working with people of all walks of life, can you just tell us a little bit about the experience of you being able to work alongside next to Machine Gun Kelly, the popular rapper?
Well, that was a whole story, but it's definitely exciting you never know who is gonna either just walk in off the street or who's gonna be looking for something in the area. We obviously have Summerfest, so we have a lot of artists that come in for that. We have, a lot of athletes in the area that are looking for health and wellness services. So it's definitely an exciting perk when you get to see people.
Of course. Now, what would you say sets IVme apart when it comes to wellness in the whole Milwaukee area?
I think we offer everything under one roof. So people can come in and get their aesthetic treatments. They can come in and get a facial. They can get an IV while they get their facial. They can, get their hormone replacement. They can get kind of everything under one roof, which is nice, rather than having to send them out to places for other things.
Of course. Now, what advice would you give to the person that maybe possibly scared to take the next step when it comes to talking about a treatment plan and tell you some of the things that they're facing?
I think the first step is just booking a consult. I mean, you don't have to commit to anything, but, you book a consult, you can kind of talk about anything that's bothering you. With aesthetics, people usually come in and they, have one specific thing that they're kind of focused on. But during the consult, we can kind of make other recommendations as well that kind of can either address those concerns or concerns that, they maybe weren't aware of. And, same with any of the wellness stuff. Just booking a consult, you can learn more, you can ask questions, and it's, you're not committing to the treatment.
Of course. Where do you see the future of wellness and aesthetics heading?
Well, I think for wellness, I think there's a huge push for like more preventative medicine. People aren't happy with the sick care method anymore. There's a lot more people that are just like wanting to prioritize their health and prioritize, preventing disease so that they hopefully aren't having to deal with the illness down the line.
Of course.
Which is great.
Now, did you have any doubts when you left the whole clinic side, hospital side, coming into this route?
Yeah, I mean, for me, you go to school for so long and you kind of in your head have this picture of working in the hospital forever or working in a clinic forever. So I definitely think for me there was kind of like a hesitancy to leave because I was like, well, are people going to take me seriously if I don't work in a hospital? Or, what are like my colleagues going to think, because I think some people that, work in the hospital kind of view preventative medicine or wellness, or aesthetics especially, as not really medicine. So I definitely think that did weigh on my mind a little bit, but, the hospital is always going to be there and my education there isn't going anywhere. So, I just kind of told myself if I want to go back, I can go back anytime. Yes, ma'am.
It's so refreshing to hear you say that because, as you know, I work in the healthcare field as well, too. And media is just like my thing, like traveling through the NCAA, NBA, NFL, things of that nature. It's like, are people going to take me serious? I went to school to get my bachelor's and master's. It's like, are they ever going to look at me serious if I go do this and say, well, why'd you go to school for all of that? And it's like, well, I always have the degree. I always have that fallback option if that was a route that I wanted to go. I'm just blessed enough to be able to be hired through the hospital that I already work at to do media for them as well, too. So it's like kind of a gift for gap now. They're keeping me like with my degree and then they're allowing me to do something that I love as well, too. So it's like I'm seeing both sides of the world. I'm able to reap the rewards of doing something that I worked really hard for and doing something that I love. But taking it back to you, ma'am, we know that you're an avid gym goer. Can you just tell us a bit about how working in aesthetics and wellness allows you to recover better than someone who does not do the aesthetics and wellness?
Yeah, absolutely. I think, for me, when I got into this field, I was already kind of living this this lifestyle where I was working out, I was prioritizing health, I was interested in all things wellness. So it kind of just felt like a natural progression to kind of go into this field because it's something I'm already passionate about. For me, as far as like gym recovery, I get an IV once a month. I get vitamin shots at work. We have NAD at work. So I've been kind of starting that now to kind of just incorporate recovery, muscle recovery, into my just whole routine. So that's been really nice. Just, working in a clinic, a nice perk that you can just do that on after your shift.
Of course. What trends would you say that you are seeing in the whole aesthetic and wellness scene?
Well, with, aesthetics, I think there's been a trend more towards kind of, like regenerative medicine. Things like Sculptra are becoming increasingly more popular over filler. I'm seeing a lot less filler now. Mm-hmm. Of course, I still think there's a place for filler, but we're really kind of getting away from that overfilled Kardashian look that was kind of popular for like the last 10 years. Mm-hmm. So that's kind of cool. And then, in wellness, the peptides are becoming super popular. For men, a lot of men are getting more interested in TRT just because more like kind of celebrities or athletes are talking about doing it. Mm-hmm. Where I think years ago it was just kind of more taboo or nobody was talking about it. Yeah,
it was new, like you said, no one was talking about it, and they didn't have these popular reps who people flock to everything that they say or do. So I totally know what you mean.
And even for women too, I think that for years, people just thought you had to just live with your perimenopause or menopause symptoms, and that was just part of being a woman, is you just had to have hot flashes, or you just had to, just endure and just kind of wait it out. And a lot more women are kind of talking about it and talking about treatments that they're doing that are working. So I think there's a lot less stigma around women with hormone care too. So
Of course. Now, how would you say that you balance evidence-based medicine with the personalized approach that many patients are seeking?
Yeah. So as a nurse practitioner, I have to have so many continuing education credits a year to kind of maintain my license. So, we're constantly doing trainings in aesthetics, further trainings in wellness, or like conferences every year, just for wellness or for aesthetic purposes. So we're always learning. We're always learning new things and the newest stuff. So we bring all that back to our practice, and we incorporate that into our patients and our plans with our patients.
Of course. As we get ready to close out this phenomenal episode, what will be that one piece of advice that you would want to give to the people when it comes to just the overall thought and additions that you brought to the whole wellness and aesthetic scene?
I think one of the biggest things that I would like to tell people is just like do research on who your provider is. With aesthetics especially, there's a lot of like unregulated providers out there who, when I was in school, I didn't learn aesthetics in school. I didn't learn facial anatomy in school. These are all skills that you have to learn after the fact. Mm-hmm. So, I've taken thousands of dollars worth of classes, hundreds of hours of classes to kind of learn this and perfect this skill. So I would just say when you're looking for any like hormone replacement, you're looking for aesthetics, just to kind of vet your provider really well and see, what are their credentials, what trainings are they doing, what's their follow-up like, what's their safety practices like. That's huge. When we're talking about injectables, especially things like filler, like some of the risks for that are vascular occlusions, blindness. Mm-hmm. So it's not, I think people kind of have a misconception of aesthetic medicine as just being like cosmetic, when it's a medical procedure. These are drugs, these are implantable devices that we're putting in people. Mm-hmm. So it can be serious. So I definitely would think just vet your providers, make sure that they're knowledgeable, they're experienced, and that, if it seems too good to be true, it probably is, when it comes to price, at least.
Of course. Are there any shout outs that you'd like to give to anyone out there that maybe helped you along the way or gave you the best advice, things of that nature?
Yeah, shout out to my partner at IVme, Heather. She is the owner. She is amazing. She has really I think, made a really great environment there for staff and clients. And the whole team at IVme is amazing. So everyone should come check us out.
Of course. Ladies and gentlemen, you've heard it here first on Line for Line podcast. I'm your host with the most, Devon Booker. That was Mrs. Abby Zimmerman. Abby, thank you for having some time for us.
Thank you.
You calling or you listening, tune in every week. Line for line. Oh yeah, I'm going line for line.